go. So last year, December 2022, I was traveling to my dance class. So while returning back to my house, I met with an unfortunate bike accident. So a man was passing the road, using his phone, and trying to save him, I had to twist my bike handle wherein I twisted this right knee joint. And that moment, I didn't feel that it was a tear. So I reached home somehow, I limped up. I put this bandage around with some, ice gel, and I slept over it. But only when I woke up the next morning, that's when I actually realized there's something more serious than just a twist. मेरी एक टांग नकली है, मैं हॉकी का खिलाड़ी था। मजनू भाई ने ये हॉकी स्टिक से मेरा पैर तोड़ा। It was absolutely swollen, inflamed, and really painful. So my journey began this way, that the morning next I had to go to see a doctor, local doctor. This doctor asked me that you just get an MRI done, and this was really inflamed. So he said that he needs to do a procedure called aspiration, where they plunge in like a needle and they suck out a lot of all these pus and the blood. Yeah, it sounds painful, it is painful. And so he did that process, and there was like almost a huge bowl of blood came out, and he asked me to do an MRI. I did the MRI, like 2 or 3 days later I did the MRI, and in MRI it was written that absolute tear. He said, let's do some physiotherapy and let's see if it works. But it was 1.5-2 months, and I was not healing. But somehow in my mind I was not being ready to do an operation, because surgery is a big thing. And as a dancer, my first thing in my mind was, if I do a surgery, will I be able to dance ever again? So I didn't have any information, I did not meet with anybody who had a similar injury. So for me, it was like, will I be able to dance ever again? So yeah, I did not want to do any surgery and stop this dancing career. So then I went to another doctor recommended by someone who's very close to me, like Malika. She is the owner of Physic 57 India, and I work with Physic 57 as a senior fitness trainer over there. So Malika told me that you should go and check with Dr Dnyanesh. He's like a good friend. So I went to Dr Dnyanesh, and he has operated for a lot of celebrities, sports personalities. So I went to him, I showed him the MRI results, the reports. He saw the reports, and he just said only one thing: you're a dancer, you're a fitness trainer, you want to revive your career. Because there was a lot of discomfort around my knee. It was like almost December, and I went to him in the month of April. So there was quite a long gap, and I was still not feeling any betterment around my knee. So he said, if you want to revive your career, the only option is surgery. So I did come back home. In my mind, it was just like surgery. Okay, it's a big thing. It's not knife it out. They'll put some fiber tape. Will I be able to dance ever again? Forget dancing. Will I be able to ever live a normal life, running, jogging, doing all the functional activities I do in my regular life? But then April, I told him that give me 1 or 2 months to think about. From April to June, I did meet a lot of football, players, sports personalities, fitness personalities through social media, and I asked them, and they all gave me the same answer. And I saw a lot of YouTube videos that surgery is a great option. Get done with the surgery. Trust me, you'll not be able to perform most of the things for the first 6-7 months or 8 months, but post that, everything will just be like normal. So that's exactly when, in my mind, I was sure that I will be opting for the surgery. So the surgery is not for a long time. It's not like a long surgery. It's just for an hour. And my doctor, I think so, operated for 55 minutes approximately. That's what he said, the time. But there is pre-surgery procedures and post-surgery procedure, which takes a little time, like the anesthesia. You have to do a couple of blood tests. So a day before the surgery, you have to do a couple of blood tests. There's blood sugar level, the liver test, and like the doctor gives you, in written format. And after that blood test, you go to the operation theater, like OT. Before going to the OT, they check your heart rate and everything, and then the operation gets done. They take you out to the OT and they look after you for some moment, that if something's happening with your heart rate or something, and then from there they bring you to the your room. So it's just for 1 hour, and then they release you immediately. Sometimes for some patients, I opted to stay back there, so they left, they discharged me the day after the surgery. So the post-surgery, the doctor comes in, checks with you, because I opted for those two options, partial anesthesia and full anesthesia. I opted for full anesthesia because I did not want to look at my knee when they are operating. Neither did I want to have any kind of feeling, that something's wrong in the OT. I don't want to get into that feeling. So I opted for full anesthesia. And so the doctor comes after the surgery, because the drug, the anesthetic drug, slowly drains off, and then you feel a little dizzy, you feel a little bit nauseous. So he looks after you. The food is a little bit, like that time they give you a little easier to digest food. And then when the anesthetic drug slowly drains out, then you start realizing the pain over here, and it is a lot. So the doctor helps you to walk with those walker. You are not going to be able to walk. You just drag your body, but that's fine. I mean, he asks you to do that. He helps you with the movement slowly. And then the next day, got discharged. Somehow, you get the crutch, so the 2 elbow crutches. And I came back home. With the first 4 days or at least a week, you will be in that full brace where you are not being able to bend your knee at all, and you got to sleep in that for a week or two, and then that brace goes off, and then you start putting hinge brace. So yeah, that's the process. Recovery for any kind of knee surgery takes time. That's the end of discussion. You cannot be a Superman. You cannot get better in 2 months, 3 months, 5 months. No, it takes a while. And for me, the kind of movements I do in fitness classes and in dance classes, those are very excruciating movements, almost like an athlete. So to do those kind of movements, this is my 5th month. I'm doing this video on the 5th month. I still have 3 more months to go before I do all those crazy movements. I can dance, I can jog, I can do straight line jogging, zigzag jogging, I can do all those. But to do those excruciating moves like contemporary dance, jazz dance, and all those stuff, it'll take a while. So do listen to your doctor. He will ask you to do your physiotherapy. Do not miss your physiotherapy sessions. Physiotherapy is a must. So there will be some supplements given to you for your bone strengthening, muscle strengthening. Your leg will become a lot smaller in size because you will lose muscle during the surgery. So you have to slowly get into the physiotherapy. Then weight training, deep squats. You got to increase the muscle mass around your quadricep muscles and hamstring as well, because the ligament has been taken from the hamstring. So your hamstring gets weaker. So you got to strengthen all these muscles. And it takes a while, but it happens. Trust yourself, trust the doctor, be patient. As I said, physiotherapy is the most important part in this entire knee surgery rehabilitation process. My doctor gave a long PDF format, physiotherapy process. So my physiotherapist, Dr. Farnaz, she's following the same process. Like, week 1, we'll be doing this, week 2, after 4 weeks, this, after 5 weeks, this. So right now I'm in a process of straight line running, zigzag running, small hops, balance, weight training, super heavy weight training. Everything started, leg extensions, leg curls. Moving ahead, there will be more process added into it. I also like to swim. So I've started swimming from the 3rd month after my surgery. So yeah, physiotherapy is the must. These are all a part of physiotherapy. So that's how you're going to recover faster. I have been a fitness trainer, certified fitness trainer with Physique 57 for the last 6 years. And I've been dancing for almost 19 years now. So I've been a professional dancer for the last 19 years. So what happens with all these activities, you get your muscle has a memory, call it as a muscle memory. And so when you start doing your rehabilitation process, this muscle starts remembering those movements which you have done in your past. So that helps you fasten the process of your recovery. But that being said, if you're not a professional dancer, if you're not a professional athlete or a certified fitness trainer, you will still be able to recover if you do your physiotherapy like religiously, as the doctor says and asks you to. Dancing and fitness definitely helps me recover a lot faster because of the muscle memory. But other than that, the process is same for everybody. I feel great. Fortunately, like my doctor was very worried about the mental trauma a lot of people go, especially with the people who in our field, like you're dancing throughout the day, or you're doing fitness, or you're an athlete, you're running, you're jumping, you're swimming, and suddenly that is the most important part of your life is taken out of you. You cannot dance, you cannot jump, run, jog, teach fitness, go to the gym, do any activities. You're just gonna sit at your house and do nothing. So that is a little bit depressing. Fortunately with me, I coped up with reading books. I paint, so I started painting. I do have a dance company, right? So I was doing a lot of back-end dance company works for my instructors, making some programs, and this is a good time for me to take a break. So I was taking some break as well. But what I would like to tell everybody over there is, if you have a similar kind of injury, like an ACL tear like me, or MCL or PCL, LCL, whatever kind of injury you have around your ligaments, joints, muscles, do get it treated. Go to a good doctor, and if the doctor asks you for a surgery, take a moment, discuss with your family, get your finances set up, because you will not be working for a long time, and get the surgery done, because this will help you in the long run.